So in terms of why are you listening to a dentist, I've already had the discussion with some of my medical colleagues here about how surprisingly the mouth is attached to the rest of the body. And there was a battle, I guess, that was fought. This is Lake Louise. It does not look like that this week. We had a big snow dump just already last week that was a big surprise to everybody in Calgary. It's just a shock that every year that it snows. But in talking to, there was this battle that happened over nearly 3 centuries ago now, where medicine and dentistry split. The division happened over what was known as the focal theory of infection, where at the time medicine was mostly relegated to some folklore about certain medicines and herbs that may or may not be effective for different diseases, but it was mostly thought that systemic diseases such as diabetes, cancer, respiratory issues, things like that were due to some infection somewhere in the body. And since teeth were a common source of infection, it was very common early on that if you had some type of medical issue, that you would just simply have teeth removed. Dentistry started fussing against that, saying, no, these are healthy teeth. And so actually, that was the major issue, the focal theory of infection, which is, of course, long been shown to be false, that since then bacteria and viruses have been discovered, the whole hormonal system was discovered. Medicine has taken off in terms of the technology just in amazing ways, but it all started, the separation started, unfortunately, centuries ago over a misunderstanding about what disease was based on, and it was not just infection. Dentistry has continued on. I actually started my academic career in medicine. I always wanted to be a physician. I had a very Marcus Welby ER attitude about what it was that physicians do, that they save lives. And then I was actually finally in my 3rd year of medicine when I realized that this really wasn't what I wanted to do, that dentists don't look after, or physicians aren't busy saving lives. They're looking after constipated old men all day that mostly cause their own problems by either smoking too much or eating too much or whatever. And I worked as a physician's assistant for 2 years and ran across a physician, a microvascular plastic surgeon who had been a dentist and came from a family of physicians, decided, nope, I'm going to be a dentist, and ended up going through dentistry and was kind of bored and thought that, well, maybe I made a big mistake with my life. Ended up getting credit towards going to medical school, ended up going into medicine, miscutting on things, so went into surgery, and it was all too big and gross, missed working on tiny little picky things, so ended up in plastic surgery and then microvascular surgery. And at 34 years old, when he was still getting home at 10 o'clock at night, he was thinking to himself, man, I should have stayed a dentist. And I ended up having a late night conversation with him once, and dentistry had never even occurred to me. Dentistry was what you go into if you can't get into medical school. And it was something that I hadn't really thought about. Ended up now I'm on my 35th year of practicing, and I was fortunate to get some credit in school. I was fortunate to get into a very good school. I went to Columbia University in New York City, and ended up sitting there in the classroom, listening to the lecturers talk about how if anybody comes in, because you all know when you go to the dentist and they have you start filling out that little medical history form, and you got to realize that as soon as you start ticking off more than 1 or 2 of those things, they don't want to see you. And you come in with something like scleroderma, and they have to start pulling textbooks off the wall, and it just becomes this big, they really do not want to see you. And they're taught in dental school will just send them to the hospital. Send them to the dental school. They've got specialists at the school that will know how to deal with all these medical problems. And I was sitting there in dental school thinking, well, I want to be that guy. I want to be the guy that they send people to. And so it ended up being another 2 years after dental school that I studied the whole field known as special care dentistry, which is where we look after people with a variety of different medical issues. And I ended up being attracted to Calgary because of HIV, that they could not find anyone in all of southern Alberta that was willing to treat people living with HIV. And they couldn't. Calgary is the largest city in North America without a dental school, and which a lot of people don't realize. And so they couldn't attract anybody coming from another dental school to come to Calgary because there wasn't a dental school. They wouldn't have any kind of academic position. So then they started looking in the States. This was right after they had the Winter Olympics, and we'd been watching the Winter Olympics because the Olympics just before that, the Winter Olympics just before that had been in New York. And so we really paid attention to the Calgary Olympics, and it just seemed like a really cool place to go and a cool place to be. And I've been there 30 years now. Love going out to Lake Louise and Banff, and love my life there. And I left the academic side of things. I left the Foothills Hospital about 10 years ago, just because of academic, just got tired of the hassle of committee work and having to write reports and things like that, and opened up the first private practice in all of Canada that is limited to people that have medical issues. And so we primarily see people that are mentally, physically challenged. We look after most of the long-term care patients from all over southern Alberta. Of course, we still look after the HIV patients and people going through cancer care, things like that. So that's why you're listening to a dentist, is because of doing stuff like this. And part of the problem is, I'm sure you've already heard, as I'm sure you've already experienced, people have already been coming up to me at this meeting saying, so who is it in Vancouver? Who do we send people to in the Lower Mainland? And I don't know. I really don't know. I've got a name for you in Edmonton, somebody in Winnipeg. There's me in Calgary. I know somebody in Toronto. I know a gal in Montreal. I think there's somebody might be interested in Halifax, but Lower Mainland, I mean, it's tough. And so and so part of my presentation is going to be, so oral manifestations of scleroderma. Part of it is what it's going to be, what you and your dentist need to know, because you may have to be your own advocate to go into your dental office and say, I know it sounds scary, but believe me, you got this. You can do this. Let me walk you through what you need to know about the condition that I have or my loved one has, so that we can work together to make this happen. Okay? And by the way, here's Trey Petty's phone number. Yeah, that's fine. That's fine. So the deal is that dentists like to keep it safe. So like I was saying, you start filling out more than one or two things on that health information sheet, and they don't want to see you. We were taught in dental school, if someone has a history of any kind of heart problems, don't see them, send them to the hospital. If they had some kind of history of cancer, don't see them, send them to the hospital. So here's with scleroderma, you're coming in saying you've got an autoimmune condition, there's rheumatoid factor positive disease things happening, we have localized and systemic manifestations of this that's going to affect my skin, my lungs, my kidneys, and my cardiovascular system. And they're like, here's a toothbrush, good luck. And they want to send you off. But the reality is that every dentist is a scleroderma specialist. They just don't know it yet. Okay? Every dentist knows how to deal with the various manifestations of all the different things, we'll go through these one by one, of all the different things that affect the oral health of someone living with scleroderma. And all dentists have the knowledge and the ability to treat patients affected by scleroderma. Again, they just may not know it yet. So this is the message that I want to get across to you today, that you may have to be your own advocate with the dental healthcare team because they're going to be scared off. But really, there's some very basic things that can be done in a dental office that can help improve your oral health, because we don't want a source of infection. We don't want a source of pain for you. You've got to maintain your ability to talk, swallow, and eat. The mouth is an integral, important part of your overall health that needs to be maintained because it's actually a part of the body. And your dentist and oral health care team can help with that as long as they're willing to. So, what are all the oral manifestations? First off, small mouth, the small opening that's very tight, difficult to get in there and keep things clean. The dry mouth that happens, the esophageal reflux that Dr. Misabi already spent a good deal of time talking about. The chronic facial pain, the jaw joint pain that happens. There is a idiopathic loosening of the teeth. The teeth get loose in scleroderma, and it can't be confused with normal periodontal disease. There's changes in taste. How do you look after things when your skin is tight and you have an inability to grasp small objects like a toothbrush, like manipulating floss? And then how do we deal with the depression that is often accompanied, because all the treatments for depression and even the depression itself ends up having a devastating domino type effect on how your mouth health is going to be. So we're going to go through each of those and different ways that the oral health team can help deal with it. First off, the small mouth, the fibrotic mucosa, how tight everything starts getting. Of course, the problems that end up happening with that is that it's tough for the dental team to get in there. We have smaller instruments. We have smaller drills that'll give us better access. Dentistry is moving more and more towards microscopic visibility. You'll have most of your dental team, including the hygienists, are now going to have magnifying glasses. And so things actually, from our perspective, are getting bigger and bigger, even as your mouth opening is getting smaller and smaller. The gum does start pulling away from the teeth. That is a part of the pulling of the tightening of the tissues. So that means that more frequent cleanings are going to happen because stuff gets down in there more often. The difficulty in forming the embouchure, in other words, the ability to close the orbicularis, the part of the muscle of the mouth to close around an object for sucking on a straw, for kissing, for your tongue movement that's related to your speech and singing, things like that. Of course, all those things will start getting more and more difficult, but that ends up affecting your ability to be able to get in there and keep things nice and clean. So what the dental team can do and what you can do on your own behalf, early intervention is very important. You don't wait till things start falling apart. We do have mouth props for dental treatment, and we're not talking about things that will jam your mouth open, but just the ability to be able to rest your mouth on something that they should be able to flag their chart to know that every time you come in, have the mouth prop out and available. They're hidden in a drawer somewhere in the clinic. Don't want to have it be a last-minute panic looking for that every time you come in. There are different stretching exercises and devices that are available. There are physiotherapists in your area. I don't know who they are here in the Lower Mainland, but there's bound to be somebody, and maybe as part of your networking, you would know who that is. I certainly know who it is in Southern Alberta, But physiotherapists that are particularly interested in jaw joint exercises and mouth stretching exercises, there are different devices out there. I'll show you photos of these, the TheraBite, the OraStretch, the Dynasplint, that are available, and even using tongue depressors. I'll demonstrate that for you to help open up the mouth, help open up the opening, and keep the muscles as stretched as it's possible to. And periodontal therapy, increased frequency with the possibility of having to go for surgery. I have yet to run across a dental insurance plan that would turn down increased frequency of cleanings as long as the dental office is willing to write the letter, as long as you have to, of course, sign off on the ability of them sharing the information. But as soon as a dental insurance company hears about that there is a medical condition that is directly affecting the person's oral health, and that's why the dental office is asking for increased frequency of cleanings, they cover it. They will cover it. We have yet to find somebody that is unwilling to, a dental insurance plan, even government plans that are unwilling to cover it, as long as somebody is willing to make that letter happen. So this is the TheraBite. It operates in a simple squeeze ratcheting formula. The OraStretch here, again, it's got a little, it has a little screw that you can see right there that you can set the limits on it and slowly open things up. Now we're talking $7,000, but the Dynasplint, which is out there, works on gravity so that it's got a counterbalance that you can see out here, that will bob. Every time that bobs down, the ratcheting mechanism in here opens up and stretches open the person's bite. But I recommend tongue depressors. So the deal with tongue depressors is that you figure out what your opening is, and you need tongue depressors, which you can either pick up at a pharmacy or Michael's. We'll have a big bundle that you can buy in bulk like this. You fit them in. The rubber band, whether you use a rubber band, just store them or whatever, but you fit them into your mouth as far as you'll go, and then you take one more and try and fit it in. Oh, like that. That's quite a stretch. And guess what? This does exactly what the $7,000 device does. If you can leave them in for at least a minute, then we know that if that is effectively breaking down some of the collagen fibers that are causing some of the contraction. Okay? Longer is better. But don't get to the point where it starts to hurt, because then you're going to have a reflex closing down of the active muscle fibers, which then makes you less likely to do it in the future. You don't want this to be such a bad negative feedback that that you're unlikely to do it in the future. But
add one a day so it gets like start comfortable and add one a day.
If you can add one a week, you're doing really good. Really good. Okay. We do this for our head and neck radiation patients. We do this for a lot of people that are having some sort of muscle breakdown where it's closing down. It's quite effective. Yeah. Could do it at least daily. At least daily, yeah. That would be great. As far as dealing with a dry mouth is concerned, this is very common in any connective tissue disorder and any autoimmune condition. We see a lot of dry mouth. There are over 700 different medications that cause a dry mouth that are available in Canada. The dry mouth xerostomia is the technical name for it, is one of the most common side effects of different medications that are out there. And it can have a devastating effect on your oral health. one of the major functions of your saliva in terms of not only does it produce the food bolus that Dr. Musavi was talking about, that allows you to be able to swallow things properly. So a lot of people, if they get a dry mouth, they start noticing they can't swallow things as easily. But you can't talk, swallow, and eat as easily either, because the saliva is important to allow your oral mucosa to slip and slide around your mouth. We will often get people come in and say, my teeth are starting to get chipped. My teeth are starting to get sharp. What's going on with my teeth? Are they falling apart? And we can take a look at old photographs and say, no, your teeth are exactly the same. It's just that your mouth got dry and things are no longer slipping and sliding around. You're starting to notice how sharp your teeth have always been. They've always been like that. Okay? Now, we'll still smooth things off because we're not monsters. But, well, some dentists aren't. And, but the downside of the artificial salivas that were mentioned before is that they really kind of just taste like somebody else spit in your mouth. And the taste isn't great, the cost is high. Should mention before I move on about what to do about it. Dry mouth is uncomfortable. It makes it difficult to talk, swallow, and eat. Increased risk of yeast infections in the mouth anytime you have a dry mouth. One of the first things we start looking at when somebody comes in and they've got a chronic infection, chronic yeast infection in their mouth is, oh, do they have a dry mouth? And we do have different ways of assessing how dry your mouth is in terms of being able to quantitatively measure it. And there are some subjective ways of measuring it as well, some different scales that we use so that we can compare from time to time. Because particularly in dry Alberta, people come in saying, oh, my mouth is dry all the time. I look at their mouth and they've got lots of saliva. And then other people come in and say, no, I don't have a dry mouth at all. They look at their mouth and it's bone dry. And so there is a very subjective component to this. But we do know that once you get a dry mouth and you're starting to wake up in the middle of the night with the tongue stuck to the roof of your mouth, or you're finding it difficult to talk or talk quickly because of your lips sticking to your teeth, things like that. But in particular, we start noticing an increased risk of dental caries. So in other words, you start getting cavities, your teeth start rotting out, simply because saliva, one of the major functions is to dilute food and rinse it off your teeth. And if you have a dry mouth, then food can start sticking to your teeth, even on a microscopic level. It doesn't matter if you are brushing and flossing 10 times a day. Food is still sticking to your teeth on a microscopic level if you've got a dry mouth, and will start to cause your teeth to rot out. So we're worried about the dental decay. We're worried about the gum disease, the periodontal disease, like it says. So what do we do about it? Well, the artificial salivas are out there. They don't taste great. I would like to encourage you, with your hydration, to consider club soda. Club soda is just this magic thing. We have a whole sheet, a whole information sheet that we hand out to our dry mouth patients. And time again, people will come back and tell us, well, I tried everything on your list, but you know what's the only thing that worked? Club soda. And there's something about club soda that's got electrolytes in it that help stimulate your saliva. It has nothing to do with carbonation. So even if it goes flat, club soda will still help stimulate your saliva. So you carry around a water bottle because you got a dry mouth, constantly taking sips throughout the day. Well, go to Costco, go to Safeway, go to wherever, buy one of the big bottles of club soda and fill that up instead of plain water. Because typically, if you have a dry mouth, it's because you're dehydrated. The problem with having a dry mouth due to systemic conditions like scleroderma or due to some of the side effects of medications that you're taking is that your body is actually not dehydrated. So you drink more water, you just have to pee more. It doesn't actually make your mouth better have more saliva. So you need some kind of coating. So that's where the club soda actually helps out with that. Because we're worried about things like an increased risk of having more cavities, you want to avoid sucking on some type of hard candy, even though, yeah, having something in your mouth does help stimulate your saliva. So stick to non-sugar hard candies to suck on. So things that are sugar-free, stay away from dried fruit just because they're so sticky, and fresh bananas. One of the worst. High sugar content and very, very sticky on a microscopic level. So not a great snack choice in between meals. Yeah. There are Biotin products on the Canadian market. They either work for you or they don't. So try to get a sample from the pharmacist. Biotin products, they have a toothpaste, they have a mouth rinse, they have a gel called Oral Balance that for the people that it works for, it's really nice to put some of that on the top of your tongue before you go to bed, so that you're not waking up in the middle of the night with your tongue stuck to the roof of your mouth, even though you do have to go pee anyway because you drank so much water because you had such a dry mouth. But the Oral Balance will help keep that from happening, help keep from waking up. Again, if the Biotin products work for you, we generally find they only work for about 20% of the people that have a dry mouth, that are complaining of a dry mouth. So try to get a sample before you invest in their expensive toothpaste or their expensive mouth rinse, because if it doesn't work for you, trying more of it is not going to work better. Either works or it doesn't. Okay? There are chemicals in both tobacco and cannabis that will dry your mouth out more. There's a real anticholinergic effect to some of the chemical components of tobacco and cannabis, and then alcohol has a secondary diuretic effect, so that will also dry your mouth out.
I was going to say, what about CBD oil?
CBD oil, we're not seeing. We're seeing it mostly in the smoked cannabis crowd. We're not seeing it as bad on CBD oil, and there are some benefits starting to be seen on the direct application of CBD oil to your tongue and to your gums that we're starting to see with people that are regularly using that. It's still too new in Canada to be able to cite any studies on that because the studies on it have been really limited by the fact that it was illegal for such a long time. So, but certainly anecdotally, our patients are saying there's a real benefit to it. There are medications out there, Saligen and Evovac, that will help stimulate your saliva. The downside of those is it kind of gets all the juices flowing, and so you'll be sweating more. You're going to have an increase in stomach acid. You might have more reflux happening with that. Every now and then we get somebody coming in that just swears by it, but it's certainly not our first line. We do want to protect your teeth, though. We want to protect your teeth by putting fluoride on, or reducing the pH in your mouth by using carbamide peroxide. And what carbamide peroxide is bleaching solution. So all those years that the cosmetic dental people have been trying to bleach teeth, one of the side effects that we've been noticing is, hey, those people aren't getting cavities anymore. Their gum disease is getting better. And it's a direct chemical effect of raising the pH, because what a cavity is lowered pH from the acid that's produced by certain types of bacteria fermenting carbohydrates. And so we're finding a direct effect with the bleaching solutions as well. Yes?
But using the bleaching solutions, can that lead to increased sensitivity?
It can
or has
if you
it
use
gotten better now?
Okay, so in terms of bleaching solutions, let me, I've got a whole set of slides on that. Let me get to that real quick. And Terry, was there somebody back there? I thought had a question as well, so, okay. So the topical fluoride exposure and the carbamide peroxide, what you're going to want to get is custom fitted flexible trays to apply this to your teeth. So that's where the dental team can get involved in terms of making the custom fitted trays for you. Things like the Crest White strips are unfortunately, that's where you're going to pick up the sensitivity, because those are around 30-35% hydrogen peroxide And that's where you're going to get really bad sensitivity. You can't use those for much more, well, for as long as you can stand it, but you can't use it for a very long time. And since we're talking about what may be a lifelong condition, that's where we want the lower percentages of the carbamide peroxide on it. As far as what you put in there, dentists are going to be most familiar with applying fluoride. Of course, we all know that if you put fluoride in the water system, you get cancer and AIDS, but it's a joke, you don't. But Calgary's non-fluoridated. We're going through that whole bit now. What's in the Lower Mainland? I don't know. I should have looked it up. We are fluoridated here? Okay. And not Rupert. Okay. Okay. So from a population, just this is my little hobby horse on this one. From a population standpoint, yes, you will see a reduction in caries. What about the reports of the increased risk of hip fractures? What about the reports of the lowered IQs in young kids? The dental community has for a long time ignored what are the other systemic effects of fluoride, and it's not just about teeth. And so I'm not as excited about recommending high fluoride doses on people, particularly on people that are having difficulty swallowing or rinsing it off their teeth afterwards. But we'll leave that to you and your dental health care professional. But we do know that carbamide peroxide, the bleaching solutions, particularly at 10%, is what we're recommending. The 10% solutions have a dramatically decreased ability to start creating thermal sensitivity, so won't create the hot and cold teeth sensitivity as much as the higher solutions. The problem has been is that whole market was developed to whiten teeth. And the higher percentages you go, the 17%, 16%, there's a 20% out there, the in-office bleachings, the laser bleachings, things like that, which all that does is just warm up the solution. There's nothing magic about the light. It's more of a marketing thing. But the whole effect of that is more of a cosmetic effect on the teeth, which is not what we're talking about here. It's not our goal. Our goal is a long-term increase in the pH in the oral environment in your mouth to cut down on cavities, to cut down on the presence of gum disease. If you happen to get whiter teeth in the process, yay, but that's not what we're after. It's not why we're doing it, okay? So no, it doesn't rank as well as some of the other solutions that are out there in terms of whitening. But you'll need to have models made of your teeth. That can be a challenge if you have difficulty opening. We end up with a couple of models that look like that we then cast into plaster. Then over top of those is made these flexible trays that you can see around the teeth here. There they are off the models, and these are quite flexible. And dog and cats love to eat these up. You fill them up with either the fluoride or the carbamide peroxide, and then wear them overnight. And so since you may be mouth breathing because of the problems with the reflux, you may be mouth breathing because of the dryness that you already have, it's best to have the long-term protection of your teeth to do it overnight. Whereas most of the bleaching protocols in dental offices, where our goal is just to whiten your teeth, they'll say, well, an hour or two during the day. Well, for your purposes in terms of protecting your teeth from cavities and gum disease due to scleroderma, we're definitely recommending overnight protocols with it. And that's just simply to protect your teeth, to hold the solution up against your teeth. So the problem in the discussion with talking with your dentist about, well, do we do the fluoride? Do we do the carbamide peroxide? the downside of the carbon biperoxide is that all of the bleaching solutions on the Canadian market are going to run you about $8 to $10 to $20 for a little tube that'll do about a week when you go back in and do it. And since nobody's curing scleroderma after a week or after a cycle of tooth bleaching, which is what they would normally use this for, this becomes a very expensive proposition for long-term use. So guess what? It's available over the counter. Dentists don't want you to know this. And guess where it's available from? Walmart. Okay? So glyoxide has been available in Canada for nearly 50 years. It is 10% carbon peroxide. It is exactly what we're suggesting that you use to prevent dental cavities. You need to have the custom-made trays, so you'll need to talk with your dental office about custom making the trays for you. They use a 0.04, 1 millimeter soft EVA. I can send you all that information, or I'd be happy to send that information to your dental office on exactly what type of tray they use. But they'll look at that and they'll go, oh, standard bleaching tray. Yeah, standard bleaching tray. Okay. And then in terms of, they'll say, well, normally we just bleach for a month or 6 weeks or whatever they normally do until your teeth are whiter and then everybody's happy. It's like, yeah, but I want to do this kind of forever. And this is where you need to educate them about, well, I'm not actually doing it for bleaching, I'm doing it to prevent problems with my mouth. Okay?
So how often do you do it?
Every night.
Every day, and that's only 2 ounces.
That'll actually take you 2 ounces in terms of how much you have to put in. Those little syringes that a dentist gives you for bleaching, those are 0.2 of an ounce, or 0.2 milliliters. They're insulin syringes is what they are. So we are using tiny, tiny, tiny amounts. 2 ounces, 125 milliliters, that'll actually get you through about 3 months. Yeah. So $20 every 3 months, not bad.
Can I ask a question, please? Over
Yes.
here? How hard is it to get that mold in our mouths?
The mold is to take the impression can be a challenge, and to once you have the impression, though, for some of our people with a really restricted opening, we'll actually do it in 2 parts, where we have these flexible impression trays that we will then pre-cut so that we can take it out 1/2 at a time and then fit it back together on our lab. Where our industry is going, though, is digital impressions. And so with intraoral scanners that are now available, I don't have one because they're real expensive, but I know a lot of offices do have a digital scanner that are mostly used for things like crown and bridge, but they can easily take a model like this and all they have to do is fit a wand in your mouth that's about that big, and then move it around inside your mouth, and it creates a 3D scan of the inside of your mouth. Those are about $45,000. My speaker's fee doesn't cover that. But isn't that cool? Like, a lot of people don't know that. And I go talk to dental people, and they're like, I didn't know that. And so it's something easy to do. So Dr. Masavi already spent a lot of time. I learned a lot about reflux just listening to her talk, and she's certainly the expert on that. But we are quite often, we will be the ones in dentistry that start pointing out to the patients, do you have reflux? Are you having problems with that? Are you waking up in the morning with a sore throat? Are you going through this? And because we start seeing the erosion on the teeth, we start seeing the teeth starting to be broken down because of the acid. And there's certain patterns that happen. And the pattern that we notice in people's mouths for reflux is different than the pattern that we would see for acid destruction of the teeth for things like bulimia, because that also has certain patterns to it that we would look in somebody's mouth and start suspecting that that's what's going on in their mouth. But we do worry about the bleeding down the throat, the increased cancer risk that comes with that, of esophageal cancer. As far as managing that, again, Dr. Masavi went through all of that about limiting the alcohol, the spicy, acidic foods, reducing acid reduction and anti-acid medications. You guys, I'm sure, could educate me on that. And again, tobacco and cannabis both have components in them that will increase the risk of that. As far as myofascial and jaw joint pain, temporomandibular joint pain is concerned, the chronic facial pain, which can be potentially debilitating for people, is going to affect people's ability to chew, people's ability to talk, swallow, and eat in general. As far as managing it is concerned, anti-inflammatories work much, much better than plain Tylenol or even opiate analgesics. And some sort of muscle relaxant is something that we will commonly prescribe for patients, even the over-the-counter, ibuprofen, naproxen, Aleve, those types of things with a bit of rest, urging people to watch their openings. So we kind of run a battle between our stretching exercises versus the don't open it too far or you're going to hurt your muscles thing, where you have to strike a balance with that. But finding a physiotherapist or chiropractor that has a particular interest in head and neck pain, head and neck musculature will make a big deal. And there are splint appliances that the dentist, you can talk with your dentist about making those, particularly if there's a component of grinding your teeth that's involved with the muscle splitting, the muscle pain that happens. And these are devices, I prefer the ones that fit on the upper jaw rather than the lower jaw. Just because on the lower jaw you've got a tongue in the way and people tend to knock them out more. And it depends on what course they took, what school they went to, whether they like to make upper ones or lower ones. But these can also be incorporated into the fluoride trays, the whitening bleaching trays at the same time, where a platform can be made that instead of grinding on your teeth, you're actually grinding on this device. And that'll help by opening the mouth a little bit. It helps alleviate. It's like wearing a splint on your arm. If you blow out your shoulder or elbow, it's like putting things in a sling, where it helps prevent the muscles from over tightening. And the dental office can really help with that. As far as loosening of the teeth is concerned, this is just an idiopathic problem that is recognized as being one of the signs of scleroderma. It can hurt. Your teeth feel loose all the time, and can lead to an unstable bite. Your teeth aren't coming together well. This is something, again, where early intervention is going to help in terms of making sure that it is not just. So the dental office needs to rule out that you don't actually have gum disease, that this is simply a side effect of the systemic condition that you've got. So they're going to be looking for pocketing, they're going to be looking for bleeding, they're going to be looking for infection around the teeth. And as long as you're looking after things, as long as it's fairly spotless, you have to understand that the loosening of the teeth in the bone of your jaws is just a component. It's just one of the signs of scleroderma. Just one of those things that can happen. But staying on top of it, making sure that it doesn't then lead to further gum problems later is going to be an important component of this. The change in taste. That's funny. So I had to switch from my Mac to a PC presentation on this, and it's just funny how the transitions are different. Sorry, little nerd out there for you. But changes in taste, of course, are going to affect your quality of life. affects your appetite. But do understand that anybody with a decreased or with a decreased saliva production will also have a change in their taste. So someone could come in to me, or you might go into your physician and you complain of everything tastes funny to me. Well, the problem may in fact be you've got a dry mouth. So if you do all those things I was talking about with dealing with a dry mouth, that actually might fix your taste problems. Although there is an independent dysgeusia, alteration in taste that has been identified with scleroderma itself. So just fixing the dry mouth may not fix it. But if you could talk with your physician about making sure that other medications that you might be taking, say you also have hypertension or you also have depression is going to be one of the big ones. All the psychotropic drugs that are used for different mental illness issues are going to cause a dry mouth. And so talking with them about using something that has less of an anticholinergic effect so that you're not going to be having as much of a dry mouth, and then treating the dry mouth whenever it's present will help with your taste. As far as tightening of the skin on the fingers, this is going to really affect your ability to use your hands and fingers to brush and floss. You just can't do it as easy. It's going to be harder. And if your hands don't bend, if your fingers don't bend. And so the different solutions that are out there for that, accommodations for brushing and flossing, going in more frequently. Again, we have had no problems identifying to an insurance company that this person has a medical condition that is directly affecting their ability to clean their teeth, therefore increased frequency of dental scaling and root planing is necessary. That we just word things like that on the insurance form, and we're getting no problems at all with getting approval for increased frequency of going in. So your plan that only pays for once a year, in fact, we're getting every 3 months out of them. Not unusual with most insurance companies. But sometimes people actually need help, actually need somebody else brushing their teeth or using a floss threader or something like that for them to do it for them. But the Radius toothbrush is the one that I think it's even on the American Scleroderma site under the dental section. I'm not real huge on advocating certain brands, but this one has the biggest handle out there. Although we have a lot of our patients, and we will do this ourselves, where you put a big glob of Gorilla Glue down inside a handlebar. So you go to a Canadian Tire, you buy handlebar scrunchy rubber things, you fill it up with Gorilla Glue, you stick your toothbrush down in it, and now you've got a great big handle to grab onto to your toothbrush. Okay? So Radius has already made something Radius has already made one that's got a great big handle on it with a nice wide head. The problem, of course, is if you have a small mouth, how are you going to get that big wide head in there? And so the one that we like better, and this has particularly been put together for when somebody's brushing someone else's teeth, is the Collis Curve toothbrush. This came out of a Dr. Collis down in the States, who mostly his practice dealt with people that were mentally and physically challenged, where someone was brushing someone else's teeth. But what you have is you have these short little bristles on the top, getting the top of the teeth, the long bristles reaching down to the sides of the teeth, so that someone only has to open the depth of the head of this toothbrush in order to get back in there. There is a Canadian distributor. She happens to be based in Calgary, and we're big advocates of the Collis Curve for people that have a limited opening. As far as dealing with depression is concerned, this is more of a secondary effect in terms of the problems that it creates. But we urge people to talk with us about this, because if they're going to have trouble showing up for their dental appointment, if they're going to end up with a dry mouth because of the antidepressants that they're on, that's going to definitely affect the sort of care that we're able to offer. And so we urge people to go and talk with somebody about it. Make sure you talk with your dental office and your physician about what's happening with you, so that that we flag people in on our day schedule in terms of knowing that they may or may not come back. We know to talk positively about them, talk positively with them. No guilt trips about not flossing, and just to really be encouraging to people, because we want to avoid this spiral of depression, where depression causes someone's oral care to get worse, and then their bad oral care can make their depression worse. So we're always trying to be very sensitive to that. And that's something, again, that the dental office needs to know about. So to wrap up, please know that the dental office, the dentist and the dental hygienist are taught not to treat people with scleroderma because of all the different medical issues that they have. However, every dental office actually knows how to treat scleroderma. They just don't know that they know how to treat it. And so you, as your own advocate or advocating for your loved one, may have to go in and say, well, here's all the things that I need. And they can look at that and go, oh, we can do this. Increase frequency? Sure. So we have to write a letter? Oh, well, we do that all the time. Have to make you bleaching trays? Sure, we can do that. We'll provide you with the first bleaching, and then you can go, it's okay, I'll buy my stuff afterwards. And all of these different things are things that the dental office can help with in terms of improving your quality of life, and to make sure that you are able to maintain your oral health so that you can talk, swallow, and eat, avoid infection, avoiding pain, and staying away from the cascade of problems that happen. Back in Banff here, again, dentists, like physicians, our first responsibility is that we want to do no harm, this Latin phrase taken from the Hippocratic Oath. And we in the oral healthcare field want to make sure that you're leaving our office healthier than when you came in. And so we know that dentistry can contribute to problems if we don't know what we're doing, but we can also help your overall health by taking some simple steps to help maintain your health. Yes, ma'am.
I have a question relating to, you were saying that scleroderma might, do I have to turn this on or what? Okay. That scleroderma might loosen your teeth. And what about dental implants? Would the same thing happen? I had dental implants, and about 2 years later, I feel now when I eat ice cream or something like that, I do feel the difference that I didn't feel before. Could this be the same problem because of scleroderma?
Scleroderma does not affect the bone or the bone healing. It comes from a different part of the embryologic tissue. It just affects the mucosa over top. It just affects the gum tissue over top of the bone. And so the bone healing itself won't be affected. What will be affected is the dry mouth can lead to increased failure of an implant, and the inability to keep things clean can lead to the failure of the implant. But the implant placement itself and the integration of the bone, locking the implant in place, which is what you need. Now, it can be affected if you're taking things like methotrexate or things like that, where that's going to decrease your body's ability to heal. Well, any surgical procedure then is going to be affected. It doesn't matter if it's in your mouth or on your arm. And so we'll see an increased infection risk because of that. But there is no, implants are not contraindicated in people that have scleroderma. There's just going to be a difficulty in access, a difficulty with keeping it clean afterwards, but not in terms of the healing potential should be the same. if you can find a dentist willing to do it. Again, that's the problem. You walk in the door, you say, I've got scleroderma. They're like, ooh, I don't want to do it. They can call me. Yeah.
Yeah, you were talking about like the dry mouth, but what I noticed with my husband, he also has dementia on top of the scleroderma. And if I go to give him his medication in the morning, which is basically a blood thinner, Apixaban, then even before that, like sometimes I'll hand him a glass of water and instead of swallowing it, it's drooling out. And I've sort of attributed that to him being dehydrated after sleeping all night, but I don't know if that's accurate or not. And he has like a partial and an upper denture, and then he has still in the front, I think he's got about 10 of his own teeth, which they already put some kind of a coating on because they were grinding right down.
Right.
And at times he's breathing with his mouth open when he's sleeping, other times he isn't. So I'm thinking from what you've been describing that all of this is dry mouth, but I'm not sure.
Could be completely related to the dry mouth, and typically with our early morning dryness people, we do suggest that they rinse out with some club soda or water first before they try to swallow pills, just because you need to lubricate everything inside first before you try to swallow something down. The drooling could just be part of the dementia, not necessarily a sign of dry mouth.
Okay, thank you.
Thanks.
Is the water in a soda stream equivalent to club soda?
No, that's just simply carbonation. So all that's doing is adding fizz to the water. And the effect on a dry mouth doesn't seem to be related to the carbonation. It's there's something in club soda, and I've read a couple of people try to postulate on what that is, but nobody's isolated it yet. Yes.
I was just wondering about a water pick, because it just seems to be easier to get into your mouth. Is that effective? I didn't hear you mention anything about them, so I've seen it on TV, oh, do a really good job, use your water pick. Is there any truth to that?
It doesn't replace brushing and flossing. There is kind of a ranking. I mean, it'll knock out, as one of my hygienists likes to say, it'll get rid of the rocks and snails, but it doesn't get rid of the microscopic stuff that's stuck to your teeth. Only something physically rubbing on your teeth will do that, whether that's a toothbrush or a floss or whatever. However, if you can't get a manual toothbrush in your mouth, like the Oral-B people are making big hay right now on a study that came out that showed that electric toothbrushes do clean better than a manual toothbrush. What they don't say in the small print is they don't clean better than a manual toothbrush and flossing. So if we've got somebody that just no way, no how are they going to floss, or if we have somebody that literally can't get their hands in their mouth to floss, or can't use one of the floss holders, and there's lots of different brands of those that are out there, and they're pretty teeny tiny, and they can get back into a person with a limited opening pretty easily. But if somebody just absolutely ain't going to do it, then an electric toothbrush does do a better job than just brushing alone. And then a water pick, and then we get people that, yeah, but they're not going to brush either. And so a water pick does a better job than just not brushing at all. But it's not doing anything magic unless you put something in the water pick water, and then that's when we go back to things like hydrogen peroxide and things like that. Fluoride solution. Sorry? Or you could
So
go,
that
yeah.
gel stuff, that peroxide stuff, I could put in the water pick?
Actually, if you're going to do something like that, since it's going to be a solution, the gel stuff is expensive for putting in, and you could put a cap full of hydrogen peroxide in the water and get a better effect on that.
Oh, thank you.
And we will often advocate to people, And there's even some good research out there showing that in a standard water pick holder, putting 5 drops of bleach in it actually does create a nice solution that has been shown to cut back on gum disease. The problem is people swallowing it. Don't want people swallowing it. That goes back to the fluoride problem. Good questions, man. You guys are great.
With tooth loosening, what are the treatments options for that?
Sorry, say it again.
For when your teeth start to feel loose, what are the treatment options?
Well, you need to find out if the teeth are getting loose due to gum disease. But once gum disease is ruled out, unfortunately, it is a component of scleroderma. And so other than just making sure you don't get gum disease, unfortunately, and I leave it up to the researchers to cure the scleroderma. And I'm not being flippant about this. No, I'm not being flippant about it. It unfortunately is just a part of it. No, the only reason that you'd have to have the loose teeth removed is if they had gum disease. And the signs of the gum disease is infection around the teeth and bone loss. That's gum disease. That's not scleroderma. Okay? In scleroderma, you can see no infection. We can see on x-ray that the bone is not being lost, and yet the teeth are loose. So there's no signs of gum disease, but in somebody with scleroderma, they can still get loose teeth. Now, the problem is a dental office that confuses the loose teeth with, oh, this must be active periodontal disease, and they end up extracting the teeth in somebody with scleroderma, when in fact the loose teeth was just part of the scleroderma and had nothing to do with active infection.
So we have one question that's come from online. Are dental anesthetics just as effective in scleroderma patients as a normal one? Will there be any side effects with the patient's medications?
There are no side effects of any of the common medications that are used in the treatment of scleroderma, including some of the cell therapies and things like that. We don't see it in any stem cell transplant medications, and no contraindications as far as any of those are concerned. We haven't seen a decrease, and I haven't read about a decrease in effectiveness of local anesthetic in people with scleroderma. The problem is that for the dental office, they may tend to lose a bit of the anatomical landmarks as things tighten inside the mouth. They're not able to put it where they're used to putting it. And so because we're aiming for specific spots when we do local anesthetic freezing inside somebody's mouth, sometimes a dentist or dental hygienist, whoever's giving the freezing, can't see where they're going. And that may be one of the reasons why they're having a decreased frequency or decreased effectiveness.
Okay, well, thank you very much, Dr. Petty. That was awesome.